to the hills, from whence cometh my help. My help cometh from the Lord which made heaven and earth. He said, He will not suffer thy foot to be moved. The Lord which keepeth thee, He will not slumber nor sleep. Oh, the Lord is thy keeper, the Lord is thy shade upon thy right hand, upon thy right hand. Oh, the sun shall not smite thee by day, nor the moon by night. He shall preserve thy soul, even
Mr. Gurley, you can go ahead and start.
Good evening, friends. A very genuinely warm welcome to all to our webinar entitled Getting the Most from Your Health Insurance and NHF Benefits. It is truly a pleasure and an honor for me to be moderating this session. It is our fervent hope and prayerful desire that all on this platform participating this afternoon will benefit in some real ways, and that this session will in fact be a rewarding and gratifying time spent. So welcome, welcome, welcome. This particular session is intended to be the first of a possible series where we explore how we can better take care of our health. Some will say our wealth is our health and our wealth is our health. But we have heard of many stories where persons work very hard throughout their lives and for wealth, but ultimately end up spending a significant portion of that wealth on their health. So it is our hope that the information shared this afternoon will enable, empower, and cause some degree of engagement in how we can better take care of ourselves by virtue of understanding what and how our insurance policies work, and how, with cooperation and in conjunction with the government schemes, in particular the NHF at this point in time, can help us to get a better handle on keeping ourselves healthy. So on behalf of the Bethel Baptist Men's Brotherhood and the Women's Federation at Bethel Baptist Church, in conjunction with the Healing Ministry, a very warm welcome once again. So to start us off, I'm going to ask the president of the Bethel Baptist Church Women's Federation, Mrs. Vinette Smith, to lead us in a word of prayer. Vinette?
Good evening, everyone. Let us pray. O ever-loving God, we glorify your name and thank you for the opportunity to come before you and to hear from you. As we gather in this space today, we ask you to bless every person online who have joined this webinar. Send your Holy Spirit upon us, Lord, and remain present among us to lead us into the presentations and discussions we will have. Help us to build a community united in harmony of love and service. Thank you, Lord, for everything which widens our knowledge and equips us more fully for the task of life and living. Teach us to know our own strengths, that we may use it to fulfill the gifts and talents which you have given to us. We humbly ask you to shower our presenters with your greatest inspiration, so that they may share their knowledge, their experiences, and the benefits of their products with us. Cause that their messages will be clear, concise, and will be beneficial to us as we listen and participate. Lord, help us to share a loving concern for each other at all times. Above all, Lord, help us to really know you, for this is the beginning and end of all wisdom. At the end of this session, may we be refreshed to move forward, to advance and see growth in all areas of our lives. Help us, Lord, to recognize that you are the God of all wisdom and you are willing to lead us forward. Continue to remind us that all that we do here today, all that we learn, is for the pursuit of truth and for the greater glory of you. We ask all this in the name of our Lord Jesus Christ. Amen.
Thank you very much, Madam President. And so it is left for me to introduce the panelists. We have 3 panelists this afternoon. And the first speaker, Ms. Nadine Edwards, is from Gallagher Insurance Brokers. She's the manager there. And the second speaker will be from Fraser Fontaine and Kong Insurance Brokers, Mr. Praveen Kumar, Senior Executive Officer. And we will also have as a third speaker, Ms. Narika Johnson, a nurse and a member of the health promotion team at the National Health Fund. So that will be the sequence in which the presentations are done. And I'm going to ask you to hold all questions until after all presenters have completed their presentations. I'm going to also ask that when you are asking questions, you do so by the raise hand feature or a note in the chat. We have persons both on YouTube and on Zoom who will identify and bring to my attention those persons who wish to ask a question or make a comment. So without much ado, I'm going to invite Ms. Nadine, someone who I've known for quite a couple of years, to lead off and to talk to us about what it is that we have, Nadine, when we have a health insurance policy. What are the components, the nuts and bolts of a health insurance policy? Over to you, Nadine.
Okay, a pleasant evening. I appreciate the invite, sir. I am not getting the permission to share my screen.
Let's try again.
Yeah, man, you are co-host. You should be able to do so.
All right. Trying again. No, it's not giving me the option to share my screen.
We just saw your screen come up a while ago.
Oh, sorry. It's not giving me the option to share my PowerPoint. I'm not sure why.
I have your PowerPoint. You want me to share it for you?
Yes,
Okay.
I appreciate it.
Okay.
I appreciate it. Thank you.
No problem.
All right, so I just want to give a little briefing of myself. I'm Nadine Edwards. I'm in insurance for more than 20 years. I have been customer service rep consistently, sales rep, supervisor, manager positions and stuff. So I am just going to give a brief description of exactly how to understand your insurance, some terms that persons might not have the full understanding of. All right, next slide, please. So I start off by saying, asking the question, what is insurance? To me, as an individual, insurance is a peace of mind. It's where I can know that if something happens in regards to accident or health, I have somewhere to rely on. So the internet or the insurance books will always say insurance is a contract. You know, a contract is between two or more persons represented by a policy. So the policy will be the written document where everybody will basically sign, in which an individual or entity receives financial protection or reimbursement from an insurance company against losses. And this loss, you will never ever find one insurance cover the full loss. So insurance is basically a 50, 70, or up to a 90%, depending on how many policies an individual might have, right? So those are some terms that we need to understand, because you have persons will think that for once you have an insurance, you're supposed to cover everything in full, right? Next slide, please. All right, understanding your health insurance benefit. So persons can be engaged or get insurance three main ways to enter the health insurance plan, right? And as the slide says, these plans differ in terms of cost, flexibility, and the provider network. The provider network will be Guardian Life, Sagicor, Canopy, NCB, BNS. You know, those are the provider networks that persons will go and visit to get insurance. But to get insurance, you can get insurance through your employer. So for example, you're working at a company, you have to be at the age of 18 to 63, because the regulation says 64 persons don't normally work. That's the time of retirement. So through your employer, from once you're a full-time staff, the employer will offer that as a benefit. Then we have the associations. You have different type of associations. Associations could be through your church, to, for example, a community base, like if you have a football club, but the most important part, it must be registered. So if the company is not a registered company, it's just some persons coming together because they want insurance, you will not get insurance like that. You have to be paid tax, you have to have your license, you have to register, and it must be a minimum of 7 persons and more. Some insurance company, I think Canopy starts at 10, but Surgical and Guardian Life starts at 7, right? And you must, the entry age is always 18 to 79. And even though it says 79, sometimes depending on the person's health condition, you might not be able to go in after the group started. So for example, a new proposal is done, say the person is 78 or 79, because the entire group is coming on, the insurance company might put all of you together. But say someone coming on during the year or even at the anniversary period, they will like do an underwriting review of the person's health, and the person might not be able to join. That is through an association. Individual insurance. Persons can go and purchase individual insurance from age 18 to 53. Again, even between the age of 18 to 53, the insurance company still would ask for a medical report, because knowing our environment now, anybody can have any illness at any age, right? So these are the 3 ways that persons can always go to get insurance. 3 avenues, 3 lanes, you can call it like that. May I have the next slide, please? So you have types of plans. You have basic plans. You have comprehensive plans, riders/supplemental. So the riders on a supplemental plan could be dental, optical, maternity, hospitalization. That means an individual can purchase a plan just for dental only, optical only, maternity only, or hospitalization only. But the guidelines to have a rider plan, the person must have a basic plan or a comprehensive plan. A rider or a supplemental plan can never be added to a major medical plan or cannot stand by itself. It has to have a base benefit for you to add the riders to it. Right? Individuals can purchase higher or additional levels of benefits, which will attract additional costs. So if you have a basic plan or a comprehensive plan, and you just want to, sorry, you want to just add dental or optical alone, you can, but it would be at an additional cost. And these plans goes with the person's age. So they look at your age and they say, okay, between X and Y age, this will be the cost. So you have those. And you have the major medical plan, which are like surgeries, hospitalization. Those, because that doesn't have a base of office visit consultation, you would not be able to purchase a rider or a supplemental plan to add to a major medical plan. All right, may I have the next slide, please? All right, so here I break out what are the benefits, the standard features of a health insurance plan. As I say, you can have the riders. So the riders are prescription. So a plan can be built without prescription. A plan can be built without dental, optical, maternity, overseas emergency, and the supplemental accident. So if, for example, the insurance company is going to put the basic and the riders, then it will come together as a comprehensive plan. That means you have all aspects of insurance, all the benefits are put together. But for a basic plan, this will only include doctor home visit, office visit, and wellness checkup. A wellness checkup, for example, if there's a health fair or a wellness checkup, is that you're healthy. You have never used your card and you just like say, okay, I'm going to visit the doctor today. Say you want to do an executive profile, you just want to know what is happening with your body. That's a wellness checkup. You go to the doctor to say, doctor, I'm feeling okay, but I just want to check if my blood, my diabetes, or anything. So therefore, you can then try to change your diet or start to do other things like exercise more, resting more, do other things that will not allow you to be unhealthy. So we also have the specialist consultation, which consider your gyno, your dietitian, your chiropractic, your urologist, or your psychologist. So these are specialist consultations, and this is at a different cost. You also have your physiotherapy and your occupational therapy. Again, this is all that you find under your basic plan. So a plan is normally built with these as the base plan. You have the diagnostics, lab, and X-ray. For diagnostics, lab, and X-ray, you cannot do a diagnosis and a lab and X-ray without visiting your doctor. So that goes hand in hand. You have the surgeries and hospitalization services where it includes miscellaneous, daily room and board, all the things, the drip, all of that is included in the hospital services. Then you have the chemo, radiotherapy, renal dialysis, speech therapy, and vasectomy. These visits you can do outside of a hospital or at a clinic, and 90% they're paid from your major medical part of the policy. So these are just other breakdown that you can find in your base policy. When you put all of these, the basic and the rider together, you have a complete package, which is considered a comprehensive. It's all around. You have time in which you have the comprehensive, but persons don't really use the word comprehensive. They can have super plans or supernatural plans. Persons have different names, but when you put them together, it's a complete plan. Right? May I have the next slide, please? All right, so I put together a typical comprehensive benefit sheet, right? So you have the office visits. The prices can be different. It depends on the plan. So if you are an employer, if you have an employer plan, they will get different levels of option in our proposal. And the employer, the HR team will say, okay, I want this for office visit. I want this amount for specialist, this amount for dietitian. They can build their plans. So the insurance company will give them 4 or 5 different options. And again, depending on the amount that will be paid out from the insurance company, it will affect the premium that the company or the individual has to pay. So when it's a per visit in any plan, that means you can go, every time you go, the insurance card will pay 1,800. When you look at the word disability, disability is a condition or the diagnosis. You go for your hypertension, your cholesterol, you have an accident, you step on a nail or you get a cut. Those are the different type of disabilities. Some plans, the office visits are unlimited. But some plans, you have a limit, a maximum of 10. So that means you can go 10 times for asthma, 10 times for your cholesterol, 10 times for a same accident, or if it's just a checkup, it's 10 times for the contract year. A contract year is when the policy starts to when it stops. So it's not naturally always January to December. It can be from February to January of the next year. It could be March to February of next year. So it all depends on the effective date of the coverage when the company or the organization or the association of when the contract starts. You have specialists and consultation visit. This is very important. If you just take yourself up and you go to a specialist, apart from a gynecologist, it will be paid as an office visit. So I have some pimples on my face and I go on my phone and I look up a specialist for pimples and I just take myself there. Your card will only pay 1,800. While if I go to my general practitioner and he says, okay, I'm recommending you to go X or I recommend you to go to Y, then the card will pay the $3,000 for a specialist visit. Again, there's a maximum. Some plans have all of these benefits unlimited, but it depending on the plan. Then you have your direct access for a gynecologist or urologist. Again, this is not on a referral basis. You can just go there 2 times. Well, the card normally gives. Insurance normally 2 times for the contract year. And you have your physiotherapy sessions, you have your lab and your x-ray. I want to speak about the physiotherapy sessions. Where physiotherapy is concerned, you have some policies that the physiotherapy only comes from the major medical. That means you have to pay and claim back. But you have some policies you get, like this one says a maximum of 10 per disability, after which it goes to the major medical, right? You have persons who go for 10 and they just don't bother claim. You must always claim because the additional amount will come from the major medical part of the policy. You have your lab, x-ray, ultrasound, ECG, pap smear, and other diagnostic services, which is MRI, CT scan, etc. Some plans will have a limit. For example, this one, but it says plus MM. MM means major medical. So when what is on the card, the $30,000 is finished, don't think that you cannot go again for your lab services. You can go, but the major medical part now kicks in. So you have to then pay and claim back. You also have R&C. R&C means regular or customary rate. So for example, if you're going somewhere to do an MRI, I always say to persons, shop around. The reason why I say to persons, shop around is because the insurance company has a rate that they will not pass. So for example, if you're going to do an MRI on your brain, the insurance company say, okay, for the brain, we're only going to pay $80. So if the MRI place that you go to, it is 200,000, the insurance company only going to pay 80. So you have to shop around, and we, as the broker, we don't know what is a regular and customary rate. That is in our unit by itself, and we will not get that information. Those information is only passed between the insurance company and the provider. We have surgery benefits. Again, 80% of R&C. Again, R&C means regular and customary rate. So you might go into surgery for a heart transplant and you get $5 million. If the insurance company says it's 1 million we're paying, it's only 1 million going to be paid. So you have to shop around, you have to know these things before you go in and put more stress on your brain. So you have to shop around, know these information before you go in to do a surgery. You have the hospital benefits. This one is a tricky one. When I mean tricky, in that most times you do not know what the hospital will charge you until you're leaving the hospital. So where hospitalization benefits, some hospital will tell you to pay everything now and then claim back. You, the patient, or whoever is assisting you, must ensure that the hospital will not be claiming if you pay everything up front. Because with the insurance company, when you submit a hospitalization claim, they sit and wait to see if the hospital will be claiming, because insurance, they will pay providers first, then the employer, then the employee or the member or the client. So be careful when you're leaving. Ensure that the hospital is not going to claim if you pay everything up front. If you do have the hospital claim, wait a while, less than 90 days, and then you claim after. Communicate with the insurance company how much is already paid out, so therefore you know what to expect. Again, it is regular and customary rate. On this, the limit is $3.5 million. That means that's the value of the plan on a contract period. So the insurance company will not pay out any amount of beyond 3.5 for major medical services. Dental and optical, 16,000. Remember, for your dental is every 6 months you clean your teeth. If it is a surgery, it comes from the major medical benefit, not from the 16,000. For your optical, for the frame, it's every 24 months. For the lens, every 12 months. And for the exam is every 6 months. So what sometimes persons don't understand, you might have the money on your card, but you cannot use it. The reason why, there's a timeline when this must be used. So you can call the insurance company and you can ask, when last, if you don't remember, when last did I buy a frame? Or you try to keep the receipt, or you try to make notes, because you might go to the provider, swipe in the card, and it will not go through even though money is on the card. So there are timeline, 24 months for the frame, 12 for the lens, and every 6 months you go and check your eyes. Be very careful. If you purchase glasses and say it broke, it lost, you cannot go and use the insurance company card again. You have to stand the cost out of your pocket. So you have to be careful where that is concerned. Prescription drugs, again, I implore persons to shop around. There will be a discussion with NHF. Always use them together, or shop around so you can get a better deal on the prescriptions, because prescriptions are very expensive. Some policies have a limit, some policies don't have a limit. It depends on the benefit sheet that each person might have. All right, this says corridor deductibles. You have deductibles for prescription for some policies you don't. But for major medical, you always have a deductible, and the deductibles are different depending on the proposal or depending on the benefit that is given. The next slide, please. Next slide, please. Thank you. So this is a typical major medical benefit sheet. As I said, major medical, you have $8 million. So for the contract period, say 1st of January to the 31st of December, the member can only spend $8 million from the insurance company. Everything else will have to be their cost. But every major medical plan, as I say, has a deductible. This one has 100,000. That means the member has to pay for the services, lab, X-ray, CT scan, EKG, MRI, executive profiles. You pay, have a claim form, original receipt must be submitted within 90 days. Insurance company have everything for a timeline. So you can't keep the receipt and then you put it in when, okay, I want some money now, or that is an excuse, or you forget, or it lost. As you get it and you're able to go into the insurance company or to the association or to your employer, you submit it. It must be signed. The diagnosis must be written on a claim form, right? You have diagnostics again, 80%, surgery benefits, hospital benefit, 80% of regular and customary rates. Next slide, please. All right, so understanding the health insurance, I want to speak about premiums. At the beginning of the slide, it spoke about contract. A contract is between two persons. The insurance company says, pay me my premium on time, you have your service. If you don't pay your premium, you cannot get your service. Some policies, depending on the employer agreement, depending on the association or individual, you have within 30 days to pay the premium. Premiums are due the 1st of January. By the 30th of January, ensure that the premium reaches to the insurance company. If you are using a card and you know you don't pay the premium, that's not being honest. So you have to make sure your premiums are paid. It is best if you don't have the money, the first thing you do, pay for the service out of your pocket. After the premium is paid, then you submit a claim. It is wiser to do that. Because look at it, say your monthly premium is $30,000 for the month, just for argument's sake. And you spend a prescription of, you swipe the card for prescription for $8,000. In January, you don't pay the premium. You use the card in January. February come, you don't pay the premium. Then you make up your mind to say, oh, I don't want this policy. You're still liable to pay the insurance of $30,000 because that's what the contract, the agreement states. So I will always implore persons, if you're unable to pay your premium on time, it's better you pay and pay for the service that you want to do and then claim back. So just in case you don't you cannot afford to pay the premium, you don't owe the insurance company because you have not used any benefit within that period that you owed. You can say, okay, I've already spent the $8,000, I cannot find the $30,000 premium. It's wiser that way because you will always have it over your head that you owe someone. And as the Bible says, you're not supposed to owe. You have a debt, you're to pay your debts. Right? So premiums, and if the members of a plan doesn't pay the premium, where does the insurance company get the money from to pay out claims? It is a contract between two or more persons. You pay the premium, you must get the service. So premiums are payable either monthly, depending on the policy, quarterly, semi-annually, or annually basis, depending on the plan. There are several options to remit premium payments. If it is an employer, it's always salary deduction, or if sometimes the employer pays in full. If it's an association, you pay the money through the association, right? But mostly for individual policies, it's transfer from bank to bank, standing order, paymaster, or direct to the insurance company, and you keep your receipts. I always implore persons, even if it is not insurance, please check your receipts. At times, you might go in hurry, or you look behind you in Paymaster, you see a lot of persons behind you, you're in there so long, and you have to rush. You rushing, your name is on it, and the policy number is incorrect. That's, again, waste time for you to come and fix it, and then it looks as if you are delinquent in your premium payments. So even if you go and pay your light or your water bill, just stop a while, double check, make sure it's the correct account and the correct name and the correct address. Because all of us make mistakes, but it is easy and better that you check before you leave a cashier station, because to go back, sometimes you don't see that cashier, they don't remember, all sort of stuff can happen. So always check your receipts. Even if you go for services at the doctor, the hospitalization, or pharmacy, check your receipts. Don't wait for those.
Yeah. So,
my time?
Please, yes, please, have a final statement, Nadine. And
okay, yeah, this is my last slide.
That's the last slide. Okay.
This is my last slide, sir.
All right, thank you
and
very
as I
much.
said before, insurance is a peace of mind, something that you know that you can rely on. I appreciate the time. Thanks for having me, sir.
Okay, thank you very much for that presentation. I'm sure you have stimulated some thoughts and some questions and need for clarification further. So let me just quickly say that the next speaker is Sir Kumar from the Fraser Fontaine Insurance Brokers. and they are also carriers of the insurance that we have at Bethel through the BTC. And I'm sure the expansion of what Nadine just did is to now look at some of the ways in which we can access benefits. Nadine spoke about the benefits. Now, Sir Praveen will now tell us how we can access these benefits and what to look for when making the most out of these benefits. Sir Kumar, welcome.
Hey, good afternoon, everyone. First of all, thank you so much, Bethel Baptist Church, for giving me this opportunity to present the questions and answers about the group health insurance policies and any health insurance policies which is available in Jamaica. So as my co-presenter, Nadine, have already given advice about how you can purchase your health insurance through an individual directly with the insurance company, through an association, or through your employer, right? So I'm gonna just, as Nadine advised earlier, that insurance is a contract. So contract have few jargons or big terms, which I will try to break down into layman languages so everybody can understand. And Mr. Garrell have already advised, if any questions you can ask me later, end of the presentation. So directly diving into the presentation. So a brief introduction about FFK. FFK, Fraser Fontaine and Kong Insurance Brokers, is one of the oldest brokerage houses in Jamaica. So we were established in 1972. We have completed 50 years this year. And the company was started by Mr. Richard Fontaine. Now it has been taken care by his son and daughter, who is Gerard Fontaine and Martin Fontaine. They are the board of the directors. And our values are based on service, integrity, and professionalism. We were awarded as medium-sized business for 2009 and nominated for 2017 by Jamaica Chamber of Commerce. So this is a brief introduction. So directly diving into the coverage details. So as you know that health insurance is a contract, and we should be aware who we can add as a dependent on our health insurance. So as per the insurance companies, under your health insurance policy, you can add spouse, including common law spouses, children, stepchildren, legally adopted children, or children for whom you have court-appointed guardianship. Birth certificate would be required to add dependent children. So when anybody wants to enroll for a health insurance plan, there is an enrollment form which a person has to fill to get enrolled on the health insurance plan. So if you are adding a spouse, you don't require any documentation, but there would be a documentation required from your employer side or from association side. But from the insurance company, it might not be a requirement. But if you're adding a children as a dependent children, then a birth certificate would be required by the insurance company. Otherwise, the insurance company might not be able to add the dependent child unless you provide the birth certificate. So as soon as you get enrolled on the health insurance, as soon as you get health insurance card from the insurance company, there are 2 waiting periods which you must remember, that everything is not covered from day one. So there's 2 waiting periods. The waiting periods are any major surgeries will not be covered until 6 months of your insurance policy. That is one waiting period. And if person is like, for example, if a female member or a male member having a spouse and she is pregnant, then the maternity would be covered after 10 months. So these are the 2 basic waiting periods under the policy, as those could be a pre-existing condition. So what we call waiting period for pre-existing conditions. So coverage is extended to newborn children. Initially, it was up to 18 years of age. Then after that, it has been extended to 21. Now it is actually 26 for guardian health insurance, 26 for statutory insurance, and 27 years up to you can cover your dependent children on your guardian policy. So now currently you have policy through Guardian Life, so you can cover your dependent children up to 27 years of age. So there is a 31 days prior notification is required to convert to a family coverage. What does that mean? Like, for example, if a person is enrolled on the health insurance plan as an individual, but after that, somebody gets married or somebody have a child and they want to move the policy from individual to employee plus one or individual plus one or individual plus family. So you need to fill those forms and submit those required documents. So, and there are sometimes situations, like for example, a person having a spouse and they wanted to change the spouse. So there's a waiting period of 6 months, which because you can't change the spouse immediately. So there you have to remove the previous spouse, remove her from the plan, and there's a 6-month waiting period, and then anybody can add a new spouse on the plan. A new common law spouse may be only added 6 months after the previous spouse, which was removed. Then we understand that sometimes we have to purchase the health insurance by yourself, as Nadine said that you can buy individually, but sometimes the insurance is given by your company for the employees, at least for the employees, and you get insurance through association. So you should wisely use your health insurance card. It doesn't mean that if you have a health insurance card, you can use blindly. So these are the few points which you can use so that you have full utilization of your health insurance without doing any fraudulence. So as it is a contract, so unauthorized use of card constitute as a fraud. So if somebody is using misuses, like for example, person going to pharmacy, buying the cosmetic instead of because some pharmacy, what they do is some pharmacy which is not like, for example, not good. So what they will do is they will swipe a card for other stuff also, which is considered as fraudulent. So you should be wise enough to use your health insurance card only to purchase your prescription drugs. As Nadine advised that there are terms you have seen on the benefit schedule, which is RNC. That RNC, sometimes it is known as UCR also. So that is RNC stand for reasonable and customary charges. And sometimes it is named as UCR, that is usual, customary, and reasonables. What does it mean? Say, for example, somebody is going for a lab test in Kingston area, and there are 3 providers who does the same lab test. Each provider charge different prices. So one would be charging 10,000, 20,000, 30,000. Insurance company, what they do is they don't pay you whatever the provider is charging. They'll not pay you the highest amount, which is charged by the provider, or the lowest. What they do is they take an average of that area. So 3 providers, they'll take average of that amount and they pay 80% of UCR or RNC. And say, for example, some people have a planned surgeries. You are always advisable to have a pre-authorization from the insurance company. What does pre-authorization means? You have a Guardian Health Insurance card. There's a surgery which you're supposed to do maybe by next month. So what you do is tell the provider who is doing your surgery, or the hospital or the doctor, to get a pre-authorization. What they do is they will send required documents to the insurance company, the cost of that surgery and hospitalization. Say, for example, it is 100,000. They will send those information to the insurance company, and based on your coverages, what benefits you have chosen or what plan you are, insurance company pre-authorize that out of 100,000, insurance company would pay maybe 70,000, and they make those payments directly to the provider. You have to just pay only out of your pocket. So you don't have to pay full amount and then claim back. It is better to get pre-authorization. Then sometimes you have your health insurance card and you go to a doctor office or pharmacy. Sometimes the swipe machine is not working, or there's some issue with the internet or something. So what you do is you pay out of your pocket. Say, for example, you have a prescription bills of 10,000. You go to Fontana Pharmacy, you swipe your health insurance card, but it does not swipe. It does not pay anything. So you pay out of your pocket. Then you have to claim back from their insurance company. So there's a claim form, which you have to ask provider to fill it. They have to stamp and put a signature. And what you do is you submit with your original receipt, all original receipts and prescription to the insurance company. Then you get the reimbursement via check, or if you provide your EFT information, the insurance company directly put that money into your account. And once sometimes we lose our health insurance card. So you know that we get 2 types of insurance cards. One is the benefit card, which shows you what are the benefits, basic benefits. The other one is the swipe card, which actually swipes the card, which you get money out of, right? So with Guardian Life, there's $500 to get a replacement swipe card, and $300 Jamaican dollar for benefit card. As your policy is handled by FFK, each member on your health insurance plan will get a Health First Premier Club card. I will advise you later how that will also help you in controlling the cost, which will enable you to pay less out of your pocket. So if anybody lose that also, then there's this $500 Jamaican replacement fee for that card as well. So terms and conditions under your health insurance policy. Nadine have advised you about corridor deductible. So that same terminology, some people use, some insurance company says it is a cash deductible, some calls it as a local deductible. What does it means? It means that it is the amount which member has to pay out of their pocket. Say we are taking an example. If you see the prescription drugs, it says 80% of cost up to 13,500 plus major medical. This is just an example. So each plan will have different major medical limits, different prescription drugs limit, 15,000, 10,000, what it can be anything. But I'm taking just an example, right? So you go to Fontana Pharmacy or Megamart Pharmacy, you swipe your card. You finish this 13,500 by swiping. Maybe you buy a prescription, maybe once or twice, you finish this. To enter into major medical, the member has to pay a cash deductible. You can name it as local deductible or corridor deductible. In this example, I have taken 6,000. So once you satisfy that 6,000, then you enter into major medical. And here, for the sake of easy, I have taken example of major medical as 4.5 million. So once you exhaust 13,500 of your base prescription limit, you satisfy your 6,000, then all your prescription drugs are coming from that major medical, which is 4.5 million. What does major medical means that? That is the maximum amount of insurance coverage which you can get from the insurance company. Insurance company will not pay you more than that amount. So that is the maximum insurance which you have through insurance company, through your health insurance. And major medical can be accessed through prescription drugs, room and board, lab and diagnostic, and hospitalization. Most of the policies in Jamaica pays 80% of UCR. So it will pay that average amount of that UCR. And some policies have 70%, some policies have 90%, depending upon which plan you are. Then it pays as per policy terms and condition. And all these benefits, which is given by Nadine as well as explained here, each member on the plan will get their own benefits. Say, for example, if there is a family of 3 members, each member will have their own health insurance card. Each member will have 4.5 million as major medical. Each member will have their own deductible of 6,000. So these benefits are in for individual if they are part of family as well. As before, it was advised by Nadine about dental and optical, the X-ray, the full mouth X-ray can be done 1 every 3 years. X-ray by twing is 1 in 6 months. Then lenses, you can cover under your dental and optical coverage amount, 1 set for 12 months, and frames after 24 months. And these dental and optical coverage also depends on your plan. Sometimes it's 10,000, 15,000, 20,000. It ranges depending upon the plan which you are on. So this is just to show what is important to submit while submitting your claim reimbursement. When the swipe machine is not working or you're not carrying the health insurance card, while buying your prescription drugs or while visiting to the doctor, you pay out of your pocket and then you submit a claim form. The basic information which you need to submit on the claim form are diagnosis. Say, for example, if it is not a prescription drugs, you did some lab test. Make sure that you mention diagnosis on the claim form. If you don't mention it, insurance company will not make those payments and they'll send a letter saying that we need some more information, that is diagnosis. So always make sure that you submit a properly filled claim form. The provider needs to provide their stamp on the claim form with the signature. If there is a specialist you are going to, right? And there has to be a referral doctor, referral physician. Otherwise, the insurance company will pay as per office visit. If you have noticed before, office visit charges are lower than your specialist. So maybe office visit would be 1,800 and your specialist might be 3,000. So if you don't put the referring physician name on the claim form, the insurance company will pay as per 1,800. They'll not pay you 3,000, which is your actual coverage. So always provide physician referring doctor name as well. Then all the receipts needs to be submitted and it has to be clearly submitted. Like for example, sometimes when you go to pharmacy, the receipt of the payment receipts are not clearly printed. So ask the pharmacy to provide you a clear print of the receipt so that insurance company can make those payments accordingly. And each insurance have a deadline to submit. It is 90 days. If any claim submitted after 90 days, insurance company is not liable to pay you that claim. Annual major medical is the maximum amount of insurance coverage which you can get from the insurance company for the policy period. And now insurance company has started giving it is annual. So every time that 4.5 million, which I took example, it will reset every year. If any person had a critical illness, 3 million has used during this year, it is not like that you'll have only 1.5 million next year. It will replenish again. Before it used to be lifetime. So as soon as you're using major medical, it used to deplete. But now it will replenish every year, that 4.5 million, whenever the policy renewal date is. So how to save money? Save money on your health insurance card. So you would be wondering, why should I save money? Because it is the health insurance card. I have paid already money, but why should I not be bothered about saving money on health insurance? So there are specific reasons so the policy which you are on, right, through Bethel Baptist Church. So it is considered as, it is an association policy. It is type of a group policy. And every year you get a premium rates, right? The monthly rates. All those premium rates depends on what is the claim utilization, how your policy is utilized by your members. Say, for example, for 9 months or 12 months, the policy period is 12 months. It's annually renewed, right? Your policy is 1st of February. Say, for example, you have 100 members on the policy, and those 100 members, as premium collected by each member, you are accumulating maybe 100,000 as a premium for 12 months. You paid, as a group, you paid 100,000 to the insurance company. And by end of the year, all people put together have claimed maybe 150,000. So you have claimed more than what you have paid to the insurance company. Then what happened? Next year, when the policy renews, they will adjust the rate. They will increase the rates according to that. So that is the reason why you should use your health insurance wisely, so that you reduce the cost, the burden on your health insurance policy, which will ultimately give you a benefit. If you have a good loss ratio, if the loss ratio is less than 100%, sorry, anybody asking a question?
No questions are allowed during your presentation.
Okay, I was
Please
hearing
proceed.
So if the policy is used less than what you paid, then you have a better option or offers getting more benefits next year. Otherwise, every year your health insurance premium would be going up. So how do you save money on your health insurance plan? Coordination of benefits. So NHF, we have a team member from NHF. So she would be advising how to use what are the benefits under an NHF card. But if any person having an NHF card, FFK discount card, and health insurance card, all 3 cards can be used together. So that is called coordination of benefits. And the member will, if you use all 3 cards put together, you will pay a very less amount of your pocket. Say, for example, you have an NHF card, but you're not using your NHF card, or you have an NHF illness and you have not applied for it, you would be paying more out of your pocket, because 80% would be covered from your health insurance, but the balance 20% every time you're paying out of your pocket. But if you use NHF FFK card, you get more discount and you pay less out of your pocket. Then another option is using of FFK VAS card, which every member has got it. If you have not received your FFK discount card, you should contact your administrator, that is Ms. Harrison. So you can get in touch with them and we will print the card for you. Then, as we don't have a regulated market in Jamaica, so each pharmacy is charging their own charges for the drugs. So same type of drugs, when you're going to one pharmacy, the charges varies. So Nadine advised earlier, always compare the cost of the drugs. There would be one pharmacy would be charging the same drugs you would be getting at lower cost. So always go to those pharmacies. Use of generic drugs. So whenever you have visited any pharmacy, you would have seen ask for generic drug. So generic drug means that the cost of the generic drug and the cost of the branded drug varies drastically. So always ask for generic drugs. They are cheaper in pricing, in cost, but they will have the same efficacy. I will show you some examples what is the differences pricing cost between generic and branded drug on next slide. Seek second opinion. Say, for example, a person is going to have somebody is diagnosed with, say, cancer, right? Any type of cancer. It is always advisable to seek for second opinion. It could be a situation that the provider whom you are visiting will not have the same, like, for example, might not have given the right result or maybe right. So always advisable to go for second opinion. Second opinion can be because of surgery also. You're going to Andrews Hospital. Andrews Hospital, just I'm taking example, is charging one specific amount for specific surgery. Maybe some other provider would be charging lower or higher. So always compare. That is the second opinion for surgeries also. Adhering to taking medicine as prescribed by the doctors. Sometimes we tend to take medicine without any prescription. So always advisable to take prescription drugs prescribed by the doctor. Discontinue signing a blank form at the provider. Sometimes what we tend to do is, like, for example, we forgot our card. And then what we tell is, like, for example, if you have a good relationship with the pharmacy, then we can tell them, okay, I'll sign a blank form for you. You can claim back on behalf of me from the insurance company. So never sign a blank claim form. You never know. You might have purchased prescription drugs of 10,000 and you then never know what that provider would be claiming from your insurance company, which will be burdening your claim utilization at the end of the year. Read your receipts. So whenever you're getting your receipts, always look for what are the medication you have purchased. You see that those medications has been put in receipt. Is there any extra medication put on your receipts? So always read your receipts. Do not lend your health insurance card. So sometimes we have seen cases where people, like, for example, some member would give his or her health insurance card to other person, family members, or a friend to use, but that is considered as a fraudulent. You should not lend your cards to anybody else. Your health insurance card should be used by yourself because it is for you. Implementation of wellness program. So now we see that even the Ministry of Jamaica is working towards changing the lifestyle of the people. So always we know that every year the health insurance premiums are going up. People are getting sick because of the too many things, lifestyle and everything. So always implement wellness program. Just try to go for a walk so that you have a healthy habits, which will always reduce the burden on your health insurance. Education session, like, for example, now Bethel Baptist Church have organized this wonderful session for the members, right? Understand your health insurance, how to best use your health insurance. So there should be educational session because you would have a health insurance plan, but you might not know how to use it. There are some benefits which is there, but you might not know that, okay, how to use it. So it is always good to have educational session. Audit system. Audit system is, like, for example, sometimes when we have the claim utilization report sent to the team members, we do some audit sessions, say, for example, if there is any fraudulent under the policy or not. Then fraud prevention. Fraud prevention happens from the employer or association side, from the member side, or from the broker as well. So we should avoid those things so that we can best utilize our health insurance. So this is just one slide showing you how the cost will differ, brand name versus generic drugs. So if you see on left hand side, you name the generic drugs, then the brand name drugs, the price is given, and the cost saving. So always move to generic drugs. So we have taken example of cholesterol, hypertension. These are the drugs which member has to take virtually every day. So if you're saving $142 per tablet, if a person has to take maybe every month, every day, twice a day or thrice a day, you can imagine how much you would be saving. And saving on this one means that you will save on your health insurance, and you will also save less out of your pocket. You will pay less out of your pocket, just actually saving money for yourself. So Health First Premium Club card. So as advised, we handles the Bethel Baptist Group Health Insurance policy for their members. Every member on the health insurance should get FFK discount card. You can see the card on the left-hand side. It should look like this. Each member, if you have a spouse or you have children, everybody should get individual FFK discount card. So how does this work? It gives you up to 10% discount. So how does it work? You go to farm, you don't have a health FFK's discount card, you only have a Guardian health insurance card. You go to Mega Mart Pharmacy, your cost of prescription drugs is 10,000. you swipe your Guardian card, 80-20, 8,000 is swiped from the card, you pay 2,000 out of your pocket, right? But if you have a FFK discount card, you present both cards together to the pharmacy. And if you have NHF card also, present all 3 cards together. What they will do is the pharmacy will swipe all 3 cards. So I'm giving you example of FFK discount card. They will swipe the FFK discount card. The $10,000 drug, they will give 10% discount. It becomes 9,000. And then on 9,000, the 80-20 rule will apply. So instead of your health insurance swiping amount of 8,000, it will swipe 7,200. So you're saving money on your group utilization. And instead of paying 2,000, you would be paying only 1,800. You're saving 200 Jamaican dollar here. So this is just example of 10,000. If you imagine the case of when you have to buy a prescription for 20,000, 30,000 or 50,000, and maybe virtually every week. So then there's a huge saving. And this FFK discount card is not only used in pharmacies. So there are 250 location island-wide, 250 providers island-wide where you can use. There are different providers. What are the providers? They're pharmacies, they're lab diagnostic, optical outlets, dentists, hospital and clinics. So there's a link where, like, for example, there's a link, you can go to FFK website. You want to see who are the providers where you can use your FFK discount card. So you can get the link also. And what I'm going to do is I'm going to send that comprehensive list to the administration team, and they can send it across to all the members. So you have an active list now. And if you see, I have taken example of the receipt on right-hand side, which actually shows you the FFK discount card. So it says total, then taxes, then FFK VAS card, and then there's a Sagicor saving. So Sagicor card. In your case, it would be Guardian card. And with the same FFK discount card, as we are aware, the cost of the lenses and frame are very expensive in Jamaica, very high in Jamaica. So with same FFK discount card, you go to Imperial Optical, Broadband and Superior Optical, you will get frame and lenses for single vision for 16,800 Jamaican dollar. The cost of frame and lens both put together is 16,830 Jamaican dollar. If somebody having a progressive lens, then it's 23,760 Jamaican dollar. Somebody is prescribed by the doctor saying that you have to have prescription drug computerized glasses, then those will cost 20,790. If somebody still wants from the shelf, the branded one from Imperial Optical, Broadband and Superior Optical, you still get 10% discount. If the cost of lens and frame is 80,000, you straight away get 8,000 discount with FFK discount card. So these are some of the providers who accepts FFK discount card. When you go to any pharmacy or any provider, you can see on their door, you can see different stickers. Sticker would be from insurance company like Sagicor, Guardian, Canopy. You see FFK sticker also who accepts FFK discount card. So we're going to send you the list, which is the comprehensive list where you can get your 10% discount. And then the administration team will share it with you. So that is a quick explanation from my side. So hope I'm clear. If you can have any question, we can ask at the end of the session. Thank you so much for the opportunity.
Thank you very much, Mr. Kumar, for a very comprehensive and very thought-provoking set of information. And I think we are going to have some questions, but could I? Right, thank you, thank you. The next speaker, before we get into the question and answers, the next speaker before the National Health Fund presenter will be one of our own meaning a member of Bethel Baptist Church, who has been the beneficiary of a health insurance policy, in fact, the FFK health insurance policy. And we wanted us to welcome Deacon Clifton Hibbert from the Bethel Baptist Church to share with us his experience as a claimant, someone who got ill and utilized this health insurance scheme, and he will tell you what in fact happened eventually. Deacon Hibbert. Is Clifton on? Yes,
Hello?
Clifton. Okay,
Oh,
okay.
yes, Jehovah Jireh, God my provider. Good afternoon.
Good afternoon, sir.
I have been a member of the health insurance plan here at Bethel since its inception 2017. I did not have health insurance before, as I told myself that I was fit and didn't need health insurance. I would have my yearly checkup and my doctor would give me a clean bill of health. My blood pressure, my sugar level, and prostate were all good. In 2017, Deacon Dennis Forrest introduced the Bethel Health Insurance to members of the church. And at first, I was reluctant to join. But Deacon Forrest was so, would convince us, so persuasive. I gave in and joined. And I am so glad I did, because in 2020, I was hospitalized and had to do lots of tests like chest x-ray, CT scan, blood tests. These were really expensive. But with the health insurance, it was quite a relief, as the insurance covered 80% of the hospital costs. As a result of my health condition, I'm required to take medications daily, which, as you can imagine, are quite expensive. However, with the NHF and Guardian Health Insurance coverage, a significant portion of my monthly prescription has made it more affordable for me. To God be the glory. I would highly recommend health insurance coverage, as this provides peace of mind and security in the event of unforeseen occurrences, as it helps to alleviate some of the extreme high costs of healthcare. To God be the glory. Thank you.
Great things he has done. Thank you very much, Clifton. And you speak with a certain amount of passion and conviction and thankfulness for having made that decision to be a part of this health insurance plan. So let us hope that your health continues to be raised at, and we continue to encourage others to be a part of a health insurance scheme once you can qualify health-wise and financially. Let us now hear from
thank you.
Sister Narika. She's one person who I met recently, and she has impressed me as someone who is extremely committed and extremely devoted to promoting health and wellness. So I just want to say that it's not often that on the phone you hear someone exuding and radiating a certain amount of optimism and wellness and joyfulness. So I want to just say that Sister Narika Johnson, a registered nurse who's a part of the NHF health promotion team, brings to us this afternoon some information about how we can coordinate these National Health Fund benefits with our private health insurance plan to make the most of our health insurance coverage. Ms. Johnson, over to you.
Good afternoon, everyone. It is indeed a pleasure to be on this afternoon. My name, as was introduced, is Narika Jackson. I am the registered nurse in the Health Promotions and Public Relations Department, and it is a pleasure to be sharing information with the team this afternoon on the benefits of the National Health Fund. All right, just a moment as I share the screen with you. All right, so I'm sure, based on the previous presenters, that everyone knows about the National Health Fund. I can just pack up and just leave, but I'm only fooling myself. There's some information that needs to be shared so that everyone is aware of the benefits of the National Health Fund, and for those who have not yet accessed the benefits, are able to access same, right? So the National Health Fund is really an agency of the Ministry of Health and Wellness. And what we do is we help Jamaican residents to access medication in both the public and the private health sector through the provision of the NHF card and the delivery of inpatient and outpatient pharmacy services for both the public and private sector. And we manage the medical warehouse and over 104 pharmacy locations in the public health system right across the island. So we are in every single parish. So this afternoon, we'll be focusing on the NHF card program. So what is it really? I've heard so many persons talk about it. Who can get the benefits of this program? Well, I'm here to highlight them to you this afternoon. So the NHF card program provides subsidy for every person living in Jamaica, any age, that is from the time of birth to the time of death. If that time of death is 555 years old, we will still provide benefits for the 17 conditions that I will speak of a little later in the presentation. So what are the benefits of the NHF card? So we cover prescription drugs, specific respiratory devices, specific diabetic supplies, specific diagnostic tests. We provide a double subsidy for children. And this is good news to everyone here. The card can be combined with your private health insurance. So what are the 17 illnesses that we cover with the NHF card program? Well, these are arthritis, asthma, benign prostatic hyperplasia, breast cancer, diabetes, epilepsy, glaucoma, high cholesterol, hypertension, ischemic heart disease, major depression, prostate cancer, psychosis, rheumatic fever, heart disease, sickle cell, vascular disease, and lupus. Lupus was the most recent condition that was added. Of note, I just want to highlight that with me today is one of my colleagues. She's Miss Latoya Petty. She is the manager of the Provider Relations Department, and she'll be able to share in on some questions that we may have at the end of the presentation. All right, so since all three cards administered by the National Health Fund, that is the NHF card, the JADEP card, and the GOJ card, have been merged into the NHF card. The NHF card will facilitate access to both benefits, both the Jamaica Drug for the Elderly program and the NHF card. So it will be just one card, but different levels of benefits, all right? So, as I stated earlier, the Jamaica Drug for the Elderly program, it still exists, and this is the program that caters to persons 60 years and older. The beneficiary may be required to pay a small fee of $40 per prescription item, up to a maximum of $240 for 6 or more prescription items. That's under the Jamaica Drug for the Elderly program, and this is for persons 60 years and older. So, all right, so having heard all of that, how do I access these benefits of the National Health Fund? Well, it's so simple. Once you complete an application form, once you have one of the 17 illnesses first that we cover and complete the application form, ensuring to fill out your taxpayer's registration number, and the doctor confirms or verifies that you have this condition, the completed application form can be brought in to us at the National Health Fund. I'll give you a little more detail on that a little later in the presentation. All right, so our children are near and dear to our hearts. So we have provided, so the National Health Fund is providing double subsidy for children. So children under the age of 19 years will receive double subsidy, that's double the benefit, up to 80% of the cost of the drug under the National Health Fund program. So the diabetic supplies, as I stated earlier, the NHF card covers some diabetic supplies. So the diabetic supplies that we cover are test strips, lancets, needles, or syringes. All right, so the test strips, they are basically used to measure the blood and the urine levels. The lancets are used to prick to obtain the blood sample, and the syringes or needles are used to administer insulin. So another diabetic supply that we cover is glucometer. So once you are enrolled for diabetes on the NHF card program, you can apply for a free glucometer every 2 years. So that's a free glucometer for persons enrolled for diabetes every 2 years on the NHF card program. Additionally, we cover respiratory device. That is, we cover the cost of an asthmatic spacer and mask. These are subsidized for persons enrolled for asthma. So the spacer really is to ensure that the patient gets the maximum amount of the medication. Say, for example, they have the pump, and when they pump, some of the medication is lost to the wind. The spacer ensures that the patient gets the maximum amount of the medication. Hence, it is subsidized on the National Health Fund card program. Another benefit is the HbA1c test. This test is covered on the NHF card program for all beneficiaries. Once you're enrolled for any of the 17 conditions, it is covered for you, but you get that test once for the year. However, for the persons who are diabetic, they get 4 of these tests annually. And this test really, it is a true indication of your levels, your blood sugar levels. It shows the average. So you remember the days when persons used to go to, you have an appointment to go to the lab to get your blood work done. And you start the good eating from Monday because you have the test to do on Wednesday. So you start eating properly and you go on fasting Tuesday night and you come early Wednesday morning to do the test. And when the blood sugar test is done, it says, oh, the result is at 7, which may be what the doctor needs, which may be the normal at the time. However, for the HbA1c test, what it does is it shows the average blood sugar reading over the last 3 months. So no longer once you do this test, you cannot trick the results. It is an accurate test that shows the average blood sugar result over the last 3 months. Remember earlier I said for the children, we provide double subsidy. So for this particular test, the HbA1c test, we cover at a cost of we provide a subsidy rather of $400 per test for the adult. For the children, remember the double subsidy, so it's $800 for the test for children. Another test is the breast cancer receptor study. What this test does is once you have been diagnosed with breast cancer, this test is, you can obtain this test. It helps to determine the best course of treatment, whether biological or hormone receptor treatment would be best for the patient. Before we move on, I just wanted to highlight to you as well that we have recently added the PSA test for men on the NHF card program. So to be eligible, men must be 40 years or older to access this benefit. So men can access this benefit once per year. All right, and you can call our customer care line to get the specifics as to what labs you can go to obtain this benefit. All right, so I want to speak a little bit about the prescriptions, filling the prescriptions in the public sector. So we have, as I said earlier, we have 106 pharmacy locations in the public sector where you can fill your public sector prescription. So that the public sector prescription basically is a prescription that you have obtained from the health center or the hospital. All right, so there are several ways to fill this prescription. In the not so distant past, persons had to sorry about that. Sorry about that. In the not so distant past, persons had to sit in the pharmacy all day to wait to fill their prescription, their public sector prescription. However, because the National Health Fund is a very innovative organization, we have several options now for persons to fill their public sector prescription. These include the schedule refill service, the drop-off and pick-up service, and the quick prescript service. All right, so the schedule refill service. So for the schedule refill service, once the person, somebody spoke earlier to being able, has been placed on medication. So they have to take medication every single day for the rest of their life. So the schedule refill service would be something that would be suitable for someone. So once, say, for example, you are hypertensive and you have to take your hypertensive medication every day in order to maintain your health, and you have a public prescription, what you can do is you can speak to the pharmacist at the drugstore pharmacy and tell them that you'd like to be a part of the schedule refill service. How this works is you would select a specific day. Say, for example, I'll be coming every fourth Wednesday to pick up my prescription at 10 p.m. The prescription will be packaged and ready for you for that time. And you will come with your original prescription and collect your medication, receive medication counseling, and you're on your way. That's a schedule refill service. And that is an arrangement between the pharmacist and the patient. So the drop-off pickup service is another option to fill your public sector prescription. The drop-off pickup service works, say, for example, you are in the Crossroads area and you have to take your medication, but you have a few errands to run. You don't want to stay in the pharmacy and wait. So you speak to the representative there at the pharmacy. We have a drugstore pharmacy there at Union Square in Crossroads. I'd like to use the drop-off pickup service because I have a few errands to run. So this is like 9:30 in the morning. You drop off your prescription, fill out the relevant documentation, tell them, I'll be back about 2 p.m. for my medication. The medication will be packaged and ready for you at 2 p.m. You receive your medication counseling, pick up your medication, and you are on your way. That is the drop-off pickup service. I'm so excited about the quick prescript service. So once you have a smartphone and you have a public prescription to fill, we encourage you to download the Quick Prescript app. With this app, you are able to fill out the relevant information, upload your prescription, and select a location, and the app will reply to you, and you get the date and time to pick up your prescription. You follow that instruction and take your original prescription with you with the agreed date and time. You collect your medication, receive your medication counseling, and you're on your way. That is the quick prescript service. So having stated all of that information, you must be wondering, how do I access these benefits? Well, once you have any of the 17 illnesses that I spoke about earlier, you are eligible for these benefits. And it does not matter your age, from birth up to, if you so tarry, till 555 years old, or we will provide coverage for you. All you need to do is pick up an application form. It's available at most pharmacies, hospitals, health centers, the NHF office at 25 Dominica Drive. You can pick up the application form, you fill out section A, you insert your TRN, and for section B would be for a person that is under the age of 18 years old or incapacitated, unable to care, somebody is their particular caregiver, they would fill out section B. For section C, this must be filled out by the medical doctor, which verifies that yes, they have this particular illness, and the doctor would fill in their medical registration number, which is their MCJ registration. And the doctor must indicate the condition that they are certifying or verifying that the patient has. The completed application form can be submitted to us at any of our same-day card locations island-wide. And we are in every single parish. Every single parish, the National Health Fund is in that parish. And once the completed application form is submitted to us, we will process the card within 15 minutes, and you would have your card ready to access your benefits within the 15 minutes. So as I said, we have locations island-wide. And you can look at this slide, and it is showing a population, a pop-up of all the same-day card locations that you can go to access that you can bring in your application form and get your NHF card to fill your prescription, to assist with your medication. So every parish, we are from Nigger Point to Moran Point. So we are in St. Thomas. We are at the Princess Margaret Hospital. There in St. Thomas. We are in, say, for example, St. Anne, we have a help desk there at the St. Anne's Bay Hospital. In Montego Bay, we are the Cornwall Regional Hospital. Every single parish. In Maypen, we are at the Maypen Hospital. In Mandeville, we are at the Mandeville Hospital. We are in every single parish. In Kingston, we have several locations. The NHF head office at 25 Dominica Drive. We have locations at Crossroads. We have location in Crossroad, which is the Union Square Drugstore Pharmacy. At KPH, we are at the drugstore pharmacy there at the Kingston Public Hospital. In Spanish Town, we are at the Spanish Town Hospital. We are in every single parish. We are willing and ready to hear from you. You can reach out to us. We are available via phone, web chat, email. So for social media, you can reach us at Facebook, Twitter, Instagram. Our handle is at NHF Jamaica. That is at NHF Jamaica. You can reach us via web chat. Our web chat is www.nhf.org.jm. You can email us, and it's info@nhf.org.jm. We are only too happy to hear from you. Thank you so much for listening. And if there are any questions, they can be facilitated after.
Thank you, nurse. I tell you that you're so full of energy and full of, that sort of Yes, it is a positive, it's a positive feeling, and thank you so much. You know, I must say this, I have had to deal with NHF on with the office on 2 occasions. And on both occasions, I left with a feeling of satisfaction and customer delight. I think it is, if not the best, it is among the best government agency in terms of giving service that is pleasant, professional, and really as to your expectation. And so I wanted to congratulate the NHF through you and your co-worker who is with you to say that I salute NHF. You're doing a great job, and I just want to encourage you to continue to grow from strength to strength. All right, so thank you very much for that. And so we move now to the question and answer period. We had scheduled another speaker to give a testimonial, but we have not seen that person, so we're going to move on to question and answer time. So the floor is now open for any questions for Nadine, for Kumar, Mr. Kumar, and for Nurse Narika Jackson. The persons online, the Zoom and the YouTube channels, please indicate if there are any persons who would wish to have any questions addressed by the panelists, please. But I could jump off with one right away, you know, because I have an interest in understanding how do you diagnose major depression. One of the conditions you raised, Narika, was after 17 is major depression. How is that determined? Could you help us with that? It's a medically, it's a doctor has to say that you are suffering major depression. How often do you have to be suffering this? I'm just, you know, I'm just curious. Could you assist us, please?
Sure. So the major depression, like any other condition, is a medical condition. So the doctor will, through their scheme of diagnosis, evaluate the patient and make the diagnosis accordingly. But it must be verified by a medical doctor.
Practitioner. Okay, I'm fine. I'm fine. All right, thank you for that. I see Clifton Hibbert, and I see Andre Earl. So in that order, could you go ahead, please, Clifton?
Okay, yes, thank you. My question is to the second speaker, Fraser Fontaine and Kong.
Mr. Kumar.
Mr. Kumar, yes, sir. Yes, I'm planning to travel in the summer for 2 months. I sent in an application to the health insurance requesting that I receive at least 2 months supply of my medication. I'm wondering how long that would take, because at least I will need this within the next 3 weeks. I've sent in all the relevant documents and waiting. So could you inform me as to how long this will take before I get an answer from the insurance company? Thank you.
Okay, sir. Hi, good afternoon. So we have submitted your request to the insurance company. So you have to give the date, right? When you are visiting to the pharmacy to buy your prescriptions. So it would be done before that, and you would be advised about that. So can you give me a timeline so that I can follow from the insurance company when you would be going?
Okay, I should be leaving the 28th of June. So I will need
28th of June.
Right, so I need supplies for July and August.
Yes, but I think in that email there was a date mentioned that you would be visiting, I think by 23rd or 25th of June to buy the prescription. So by Monday, I would be able to get back to you with the approval, because the insurance company, they have to open this specific pharmacy, and they have to open the code so that you can buy a prescription for 2 months or 3 months maximum.
Okay, thank you.
But I'll get back to you on Monday for this one, for sure.
Okay, thank you.
Thank you for that, Clifton. Andre?
Good afternoon, everyone. Chairman, I join you in congratulating all speakers on their excellent presentations. And also congratulations to you on your adept control of the proceedings. Your usual adept control of the proceedings. Two quick questions, Chairman. The first one is directed to the speaker who came from Gallagher. I think it's Miss Edwards.
Yes, it is.
Yes. Thank you again for that presentation, Miss Edwards.
You're welcome.
The question I have is in relation to Major Medical. Last year, I gather there was some facility whereby you could participate in the Major Medical if you did so and communicated your interest by December. I sent emails everywhere, including to CCRP and to Gallagher, and I received one of those automated emails that said that someone would have been in touch with me. Unfortunately, no one was in touch with me. And so I'm in a situation where I didn't benefit from this increase. How can I do so?
Okay, that's
If
a
at
very
all
good
possible.
question. All right. So my first question to you before I answer, did you send an email to the CGM_CCRP Health saying that you wish to transfer from the CHIP to the Major Medical
Yes.
before the 31st of December?
Yes, I did.
Awesome. Did it bounce?
Not as far as I know. I
Right.
got a response that said someone would be in touch with me, but
Well, we don't send such email. I am the one that generate that email, and we don't send such email. So probably CCRP would say someone will get in contact with you.
okay.
But I want to give you my cell phone number. I can give it over the air, that's fine. And on Monday, you can call and I'll search for the email. However, if I don't find the email and you resend the email because of the date of the email, from once the email is dated, we can always get you on. But be mindful, if you have used the chip card between the 1st of December to present, more than $15,000 used from the card, you cannot be transferred to the Major Medical.
Oh. And well,
Yes.
I'm not sure if I have. I'm not sure if I have yet.
Well, I can check for that on Monday. You have a pen, let me give you my number.
Pen and paper in hand.
552 3423.
All right. Thank you very much.
No problem. So from once you have that email, from once you have not used the more than 15,000, I can have you transfer.
All right. And there's no way else, if it is that you don't satisfy those conditions, there's no way else to increase that Major Medical?
You can apply, but that would be for 1st of December. And at that time, it's not a transfer, it's a new application. New application, just as what Mr. Kumar says, it comes with a waiting period. So when a transfer, you transfer without no waiting period. So if there should be a surgery or anything like that, surgical is not going to deny the claim or the procedure to say you have a waiting period. But applying, that means you're new and you have to serve a waiting period of 6 months.
All right. Thank you very much, Mr. Edwards. I did say, Chairman, I had two questions.
Two
the second
questions.
question,
Go ahead.
hopefully is a lot easier. And that relates to, I think now, Miss Narika from NHF. So this question is to you. I had a rude awakening recently when I was told that senior citizens start at age 55. So senior citizens start at age 55. I wanted to know, Ms. Narika, if anyone who is 55 and over qualifies for the drugs for the elderly program?
All right, thank you for that question. All right, we love our seniors at the National Health Fund, and the Jamaica Drug for the Elderly program actually starts at age 60. So only persons 60 and over at this time would qualify for that program.
In other words, Ms. Narika, you are saying if you are under 60, you are not a senior citizen.
No, I'm just saying for the purpose of this program.
No, you don't have to answer that question, Ms. Narika. You don't have to answer that question. That question is really for the chairman. Thank you very much, Chairman.
All right, Andre. Thank you too, Andre. Thank you. I see Lawrence.
Yes, that's me.
Yes, sir.
Yeah. Thanks to the team, organizers, and everyone for a good session. And Andre has received a benefit out of this session that he can now consider himself a young man.
Right.
Anyway, there's a question on YouTube, you see?
Yes.
From Sandra Brown Thomas. She said she joined it. Can Mr. Kumar say why the Guardian Bethel Health Plan does not cover teeth extraction? You got that?
Yes. Sir Kumar, can you, well, this is a specific plan. So could you go ahead with that, Mr. Kumar? There is no extraction benefit on the FFK plan. Is that so?
Yes. Okay. So what I'm gonna do is so have you received a denial request from the insurance company about the tooth extraction? If I can ask.
What happened? This person cannot converse with us.
Okay.
There's a time because they're on YouTube. So there is a delay in terms of information going across.
So what I'm going to do is, because my information have already been shared on the message, maybe you can reply, you can send my contact number to the person, and maybe he can contact me on.
Oh, that's the 876-936-1140.
My cell number is 775-3892.
775-3892.
3892.
All
yes.
right.
So the person can contact me on Monday. I'll check with the insurance company and come back to you.
Okay.
Because it is not specific to PTC. If tooth extraction is not covered, it wouldn't be covered any of the policy. So it's a generic.
Okay.
I know as far as root canal is covered under surgery, root canal and crowning, but tooth extraction may be covered, but he might have finished the coverage amount. Remember, you under dental and optical, you have a specific coverage amount. Once you finish that, then you don't have any coverage for dental and optical. So I need to check those things from the insurance company.
Okay, thank you.
Okay. Yeah. Thank you for that, Sir Kumar. I have a question from someone on my WhatsApp. So I'm going to try to see if I can.
And Deacon Girl.
Sir, yes?
Yes, we do have a few comments and questions as well from Zoom. So once you're finished, I could read.
I'll allow you to. Sure, Kurt. Sure, thanks. The question is, when I swipe my card, it says that there's nothing available, and I'm sure you addressed it earlier under the deductible section of your presentation, but as I have come to learn over the years, Sir Kumar, this matter is one of the most problematic aspect of health insurance, where someone has what we call an annual limit. Let us say it's a drug benefit of $10,000, but there's a major medical attached to it for 1 point something million, 2 point something million. So they go to the pharmacist, they swipe the card a couple of times, and when it gets to $10,000, it says that your prescription benefit has been exhausted. So I think if I'm interpreting the person right, she says, "How do you know you can submit for a claim and it is not that the user have to pay your amount before accessing benefits?" So this is speaking, it seems to me, exclusively to the issue of deductible management. How can we simplify it, Sir Kumar? This has been a perennial challenge for health insurance companies and for users of health insurance. Nadine, I'm sure you could confirm that. It is one of the most troublesome
Yes, it
aspects of
is.
this relationship. So can you in 2 minutes, Sir Kumar, just see if you can advise this member for me, because she's saying I'm saying for her, I think she feels cheated, that she thought she had a health insurance plan. When she goes to swipe, what she gets is just a little pittance, and she said, but I'm paying for this, so what is going on here? But we know that there's more money elsewhere, but it's just a question of how do you get to the toll, pay the toll. My example is pay a toll, get onto the highway, and then so I don't know if you want to use your own example.
Okay, so as far before in previous days, right? The member was supposed to pay the deductible, the member portion. They were supposed to submit the claim, the reimbursement claim. Then only insurance company used to come to know, okay, the person is satisfying the deductible. Now they have to give access to major medical. But since the technology advancement with all three insurance companies, now once the deductible is satisfied, it is automatic. Member automatically gets into major medical. They don't have to do anything.
No, but
Now
stop. Speak to the term satisfying the deductible. That is the next. So that is where the problem is. What do you mean by satisfying the deductible to get access to the bigger fund to take care of our health? That is a very, very important question.
So let me share my slide one more time where I gave the example earlier. So I think that would be clear with that slide. Okay. Give me a second. Say for the example, this, you see in the middle, you see prescription drugs.
Right.
It says 80% of cost up to 13,500 plus major medical. Okay.
Correct.
And on top, you can see cash deductible, local deductible of 6,000.
Right.
So person goes to any pharmacy, they can swipe their card up to 13,500. Okay.
Right.
Once they finish that 13,500, then the member has to pay that 6,000 deductible out of their pocket.
Okay.
After you satisfy 13,500, you next time go to buy a prescription of 10,000. The pharmacy swipe the card. They will always tell you that there's no fund on the card, but the person has to tell the pharmacy that I am on the verge of deductible. I will enter into major medical, because the problem is not with the health insurance or with anybody else. It is the problem with the pharmacy. What happens is the people at the pharmacy keeps on changing, okay? And they are not aware about what the process is. So as soon as the people go there, they don't see the funds. They say that, okay, there's no money on the card, but they have to re-swipe the card. So after you finish 13,500, the 10,000 prescription you need to buy, insurance company will not approve that 6,000, because that is 6,000 you have to pay out of your pocket, right? But the balance 4,000 will be covered under your major medical. It gets automatically under your major medical, and that 4,000 will be paid 80-20. So 80% of yes. So it
stop
is
a second for me again. No, stop a second
yes,
for me again. And I am being very unconventional in stopping you in mid-sentence, but it is
no. I do understand, sir. This is very important
that I nail this one down in this session. It is one of the most challenging things to understand. Now, when you say pay 6,000 out of your pocket, break that down for the customer and tell them how they get that 6,000 into the system, because that is another part of where the problem is. They know that deductible to get access to the major medical, which is a larger amount of funds to take care of their health needs, is there. But the pharmacy is wanting with the swipe, but they themselves are not sure how to get that $6,000, which I call a toll fee. So you are driving on the regular Mandela Highway, but you are now going to the North-South Highway. At Mandela, at Ferry, you are going to pay a toll fee of $6,000 to enjoy the highway, which is the major medical. So you are driving on your regular prescription drug benefit up to from 6 miles to Mandela at that toll plaza. And when you get to the toll plaza, you're now going to take out $6,000 in some way, shape, or form, and give to the toll plaza personnel and say, this is my deductible or my toll fee to enter into superior benefits, a superior road, a superior driving experience, a superior traveling time. So explain for us how that 6,000 gets into the system from the consumer, please.
So that 6,000, this 6,000 doesn't come as exactly as 6,000. So what happens is there sometimes you can, like for example, you buy a prescription drugs of, in this example, you buy a prescription drugs of 15,000, right?
Right.
First time card, a member got first time card, they're going to buy a prescription for 15,000. You have a base coverage of 13,500. That would be swiped from the card. The balance 1,500, the insurance card will not cover because that would be your deductible. So you will, the person on first transaction will satisfy only 1,500 from the deductible. So the 6,000 deductible, in this transaction, you satisfy 1,500. The balance is 4,500. Next time, the person will go again to the pharmacy to buy prescription drugs. Next time, say, for example, 10,000 prescription drugs is the amount. Then they have to satisfy that 4,500. It is, you like, for example, it's not a fixed, that total amount that it automatically comes at 6,000. It's easy. 6,000 you pay in one transaction. Sometimes it happens
in several, in pieces.
Several transactions, yeah.
Exactly,
and also, it is not only prescription drugs where member can satisfy deductible. Say, for example, somebody doesn't buy advice to buy a prescription. Somebody first time goes to lab and diagnostic. So person can satisfy that 6,000 from lab and diagnostic also.
Correct.
But that 6,000 is cumulative and that is one time per annum. So that can be satisfied. Sometimes the small amount can be satisfied at prescription, and then after prescription go to lab diagnostic. That also can be satisfied from there. But we, like for example, the member might not know how much deductible he would have. So what they can do is they can contact the administrator at BTC and ask me, okay, I'm not sure how much my deductible is balanced. Can you check with the insurance company? I can go back to the insurance company and come back, okay, out of 6,000, you have only 2,000 balance. So when you go next time, it would automatically satisfy because the prescription drugs amount, the cost is always more than 2,000, right?
All right. So in other words, when the person, so the person has to pay that money out of their pocket. That's the crucial part. The person, that 6,000 has to be paid over the counter to either the pharmacist or the lab provider. That money is paid from pocket. That is your toll fee. That toll fee to go onto the big highway of the major medical is paid out of pocket. So you can't be claiming that on your card.
No, you can't claim that.
That is the point. That is the point. So the question that the person is asking is, when they pay that 6,000, is it automatically registered and credited in the system? So when they go next time to now use the 80/20 with your card, that the system would now have updated to say, hey, I paid my 6,000 deductible / toll fee, and so I am now into major medical, which is the highway, the north-south. And so is it automated? Is it automatic? Or there is something else that could unbug the process of them getting access to the major medical? That's the question that you can end with. Is it automatic? When you pay the 6,000,
it is automatic.
It is automatic.
It is automatic. It is
okay,
automatic.
Great.
So like, for example, if this particular member, if she or he is feeling that, okay, he's still paying, looks like he's still paying that 6,000 again, what he can do is, I can inquire from the insurance company, or maybe next time when he goes, maybe you can submit a claim form, because you'll not get paid for that 6,000, but the balance which you would have paid after satisfying the deductible, you might claim back. But we can always check with the insurance company if the deductible has been satisfied or you're still in the deductible. Because sometimes the 6,000 is over few transactions, not in one transaction.
Exactly. And maybe around 6,000, it can be 20,000. So it will vary, but you need to know what your deductible is.
Yes,
so that
when on your plan.
That is on your plan. So when you go and you're seeing that you're being a night service, It isn't that your policy has run out of benefits. It is hardly the case. It is that you need to know, pay a toll, I think it's a toll fee. I call that toll fee. Pay a deductible fee to get access to the highway of the superior benefits. Okay, Mas Kirk, you're a lot of Andrew said. So please go ahead and identify and ask him to go ahead, Kirk. Thank you. Thank you, Sir Kumar. Thank you for that. Thank you.
No problem, sir. No problem.
Right, so there are a few comments from persons expressing thanks and appreciation for the excellent presentations delivered. And in terms of the questions, the first one is, what are the benefits of using a broker such as FFK instead of going directly to a provider? The second question is, who is responsible for generating a utilization report upon request? Is it your employer or insurance company? And I believe, oh yes, there's a third, well, it's a question / comment. The person says, thanks for your presentation. I have a challenge getting my hypertension generic drug on JADEP every month. So those three questions.
All right, let us start with the two first. Let's start with the two others first, Kurt. So the first question has to do with what again, Kurt? The first question is what?
What are the benefits of using a broker?
Right,
such
broker
as
versus going to the provider. Now, it's a little, to ask two brokers that question could be a little. Anyway, I'll allow them to answer. Go ahead, please. What's the benefit of having you guys in the picture, please? Nadia.
Okay, so yeah, Nadia, you can, yeah.
Don't rush now. Don't rush.
All right, so I like to put things in the most simplest term ever. All right, you have a motor vehicle accident, right? And you go directly to the insurance company. Whatever the insurance company says, you just have to act. You, the individual, doesn't know insurance terms, the policies, and the way about. So basically, a broker is like a lawyer. They represent you, right? So they speak for you. So when you go through a broker, it's an advantage. Person say, oh, it's not. It is an advantage because we know the insurance terms. We are able to assist in the member completing the forms and to put what is the necessary information that is needed if there should be a claim. We all, as a broker, we should also be, we hold your hand like a mother-father relationship. We should guide our clients what to do, what not to do. We, just as how we have this education sessions, because where I work at Gallagher, when a client comes to me, they have a question, and or they look at it literally. When you explain how it works in insurance, they better understand what to do and how not to do. Again, if you go to, just as if you go to court by yourself, you stand alone and you might lose. But through a broker, in which the brokers are commission paid, we have to ensure that we keep the client. We have to educate and we have to defend the clients. Kumar, am I correct?
Yes, you're exactly on the point. I just want to add on top of that. Say, for example, when your policy is due for renewal, right? There's a high loss ratio. When your policy is directly with the insurance company, they'll just show you that, okay, this is one-pager sheet. This is your loss ratio. You have paid 100,000 as premium, but you have claimed 150,000 as claim. So we are increasing your premium by 50%. So we as a broker don't accept those terms and conditions. So what we do is we do lots of analysis of your data. We dig down on your claims. What are the types of claims your policy had? There could be some situation where you had one of the member who had a critical illness claim, and after that, he's not supposed to have that claim, or maybe an accidental claim. And next year, you're not supposed to get that claim. And we try to negotiate the pricing, the benefits from the market. Because as Nadine said, we represent you as a broker. So for us, you take Guardian policy, you take Sagicor policy, you take Canopy policy. What we do is we negotiate on your pricing, we negotiate on your benefits, whatever the requirements is. And also at the time of servicing, when the claims if it is not paid as per terms and condition, and we fight for you with the insurance company. That is a nutshell. So
Okay.
it's not one day benefit from FFK or CGM Gallagher. It's an annual contract which we have,
Okay.
and we'll
just
always
to-
stand by you.
And just to say that I'm not batting for the brokers, right? But just to can you tell the public if when someone purchases a plan through you, if they pay more than if they went straight to the brokers, straight to the provider, would they pay more?
No, it is not like that. So let me put this way. So 3 ways you can get health insurance, right? When you go individual, you're buying health insurance for yourself. There are 2 insurance companies who underwrites individual health insurance, Sagicor and Guardian Life. Canopy still don't have those individual policies.
Right.
You go directly to the insurance company, or you come to FFK, or you come to Sagicor. Those individual rates are the same. You take it from anywhere, but
That's
you'll
what
get the
I want.
servicing from the brokers. Let's put it on a group perspective now. Your
Right.
company is taking a policy. As Nadine said, if the brokers are also paid a fee, the commissions, right? So what happens is when you have a policy directly with the insurance company, it does not mean that it is directly. You have the agents in between, but that would be from insurance company.
Right.
The insurance company is paying that fee, the commission, to those agents. There's
Right.
still always that amount is always there in your policy, but it is not like that I'm moving to a broker, the price is increasing.
That's
But we
correct.
would be doing more benefits to you because we would be negotiating the pricing. We would be giving you more services. Yes.
Among
More benefits.
several carriers. And the key
Yes.
point is that you are able to compare prices, rates, and benefits among several providers. Whereas
That's
if you went
correct.
straight to a provider, theirs would be the only rates and the only benefits that you have to contend with. And you're not paying
That's-
any more at all. I think I
Yeah,
heard a little commission from you and Nadine there, Mr. Kumar. Okay, so the other question had to do with utilization. You want to answer that one, please? Utilization, it had to do with who generated that, Kirk? That was the question?
Okay.
Right.
So
Who
as you're
who is responsible for generating a utilization report upon request? Is it the employer or the insurance company?
Correct.
So it is because remember, it is the insurance company. So as your employer, as a broker, we are the facilitator of the service. So all the documents, the claim documents which comes to us are submitted to the insurance company, like for example, reimbursement claim documents. All the swipes done at the terminal, at the pharmacy, or at the provider, it is registered at the insurance company. So those loss ratios are generated by the insurance company. And if we have a broker in between, then we request that from the insurance company and we submit to the client.
Correct.
But it is always generated by the insurance company because they have that database.
Yes. Thank you so much, gentlemen. Sir Kumar. So is there any other comment? Anything from YouTube?
There was a
Giles' hand was up, I
another
saw.
comment where the person was saying that she's having a challenge getting her hypertension generic drugs on JEDEP every month.
Okay.
So we wondering if we could get that addressed.
Sister Narika, you want to say a quick word on that, please?
Hi, afternoon, Latoya, Petty Provider Relations
Okay.
Manager here.
Okay. Sister Narika.
Just to reiterate, I saw the question. We have been having supply chain issues with a lot of drugs out of stock, and we have been awaiting the ETAs from the supplier. Just to say that we obtain the JADEP drugs through a tender program. So we get these drugs through suppliers and they are having some challenges. What I will ask Ms. Stevenson to do is to reach out to the National Health Fund because on a daily basis, we assist the beneficiaries to obtain well-needed drugs. We have over 260 providers on the JADEP program, and they order through the NHF based on the prescriptions they see coming in. So if you can just alert us as to the area you're in, we will be happy to assist you in obtaining your drugs. Bethel Baptist is also a JADEP provider, so they will be able to assist you. I'm hoping one of the drugs you are trying to obtain is not one of those that have not been on the market for a while and that the prescribing pattern has not changed. So if you reach out to us, you could call the NHF tomorrow, press 1 for provider relations, and just let them know you heard that you can call us, and I will direct the team to assist you in obtaining that drug. Or what you could do is put your number in the chat and I will reach out to you personally if you're not averse to that.
Thank you very much, Ms. Petty. That was very useful. Thank you. Any other comments, questions on either platform?
There are no comments on
Ms. Giles.
YouTube. There was just a follow from there was just a follow from Sandra Brown Thomas in YouTube where she said the dentist said it did not. That was the question that was addressed to Mr. Kumar earlier. But there are no other comments on YouTube at this moment. And as Deacon Brown has indicated, there is a hand from Deacon Giles.
Okay, thank you. Deacon Giles?
Thank you, Mr. Moderator. My question is for Ms. Edwards from Gallagher. I have the CCRP Gallagher Major Medical Plan, and recently I had an experience where I felt cheated. I did a biopsy, and when I submitted the claim, it was denied on the basis of reasonable and customary. Now, I didn't know that I could shop around. I'm just hearing that this evening. I simply followed my doctor's advice. The procedure is something that was covered or is covered under major medical, yet it was denied because I suppose the insurance company felt that my providers overcharged. But then my question is, if they felt that I was overcharged, why did not they reimburse me what they considered reasonable and customary rather than denying the claim outright?
Okay, so that's a very good question. But I like to start off by asking a next question. First, not asking what the cost is for biopsy, and add, as I had indicated before, that reasonable and customary rate, we are not aware of it. So I can investigate the claim of what the reasonable and customary rate for that particular procedure is. But the first question would be, have you served your $100,000 deductible as yet?
No, I did not. It was the first claim that I was making under. I switched to major medical in December last year. So that was the first claim that I was making.
So let me explain what is happening with the first set of claims that persons do transfer. The first set of claims that will naturally, the reason why that I don't like to use the word denial, but the first set of claims that should be done should be the amount has been applied to your deductible. Between December and January, we had a lot of claims being denied for the persons who transferred. And when I gathered all of that information, submit it back to the claims department, it is that the wrong reason was applied for the denial. If, for example, the biopsy is below 100 or it is 100,000, you should get back an explanation of benefit sheet that says amount has been applied to your deductible. So anything else after 100,000, then it should be 80% of the regular and customary rate. But so not saying that that query that you sent to me will be paid, because if it is resubmitted, it will be resubmitted, and the reason should be this amount has been applied to your deductible. You understand? So I think the reason for the denial is incorrect. So when those claims come to us as a broker, we will then investigate and have a correction done. When the transfers were done, firstly, Mr. Kumar can tell you a transfer is not a regular insurance activity. It is only given on the authorization of the insurance company. Knowing the size of the CCRP, I was the person in charge of transferring major medical. and I don't complain about work, ask Mr. Garrell. However, what the confusion was, persons look at the premium, choose to go to the major medical. In the middle of January, December, a lot of persons say, I want to go back to CHIP. So therefore, it gave more work, more admin work for both the claims department and the admin team at Sagicor, putting back person on, off, changing, making decisions. So what had happened, the setup for all those change was not corrected. So what the marketing department says, as soon as those claims come in, the corrections are done one by one, because again, a lot of persons between December and January change back to the CHIP. So some of those reasons why claims are being denied is because the persons use a CHIP card, use more than 15. So even though they request to be transferred to the major medical, they have to stay on CHIP. So some of the reasons of the denial was correct and some was not correct. And I am 90% sure that your claim was denied for the wrong reason. Because the first thing, as what Mr. Kumar had explained about deductible, you have to complete your deductible before anything is paid from your major medical. So I'm going to repeat my number. So I want you to call me tomorrow, or if you have the explanation of benefit sheet, you can take a WhatsApp picture and WhatsApp it to my phone and let me investigate it for you. You have a pen to take my number?
Yes, I do.
552
Uh-huh.
3423.
Okay.
All right, so
554-342. Okay, 3423. Okay.
34.
552-3423. Yeah.
Yeah. So you can WhatsApp me the explanation of benefit sheet and I can investigate it for you.
Okay, will do.
Thank you. Thank you for that question. Thank you for the question, Evelyn. Before I ask the other question, 1 second, please. Could Mr. Kumar, could you remove your screen, please? It is still on the as a shared screen, I think. Could you close that so that I can see? Is it possible to take that down, Mr. Kumar?
Yeah, I'm trying. Just hold on.
Okay, thank you. Okay, go ahead, Nadine. You want to say something?
No, I'm good. I'm good.
Okay, I have a question for Sister
I
Narika.
can take it down.
Oh, sorry. Go ahead, Kirk.
No. I was saying the screen that you were seeing was a information screen with the numbers of the persons that presented, the companies that presented earlier.
Okay. At the end of the session, we just put it up. Thank you, Kirk. Just hold it for me for a second, please. All right? Thank you.
Sure.
Lawrence, have a
Thank you.
Lawrence.
Lawrence, go ahead.
Yes, I think this one is for Miss Edwards. There was a slide that she put up early in the presentation, which led me to make a note to ask whether or not to ask what happens to one's insurance when somebody hits 79 years. It seems like there's no provision for people who are 80 and over.
Okay. I was explaining the entry age to get onto an insurance policy. So persons can enter from age 18 up to 79, and through the 79 it is really on an association plan. However, on the CCRP we have persons up to 110. So for once you pay your premium, you're still alive, you can still be on it. But for the CCR plan, you have to enter before age 80. So we don't put age 80 on it because if you're already 80, you cannot enter. So it's 79.
Okay.
Okay.
I have a question for Narika. Thank you for that, Lawrence and Nadine. Sister Narika, is still there? Sister Narika?
You can go ahead with the question, sir.
Okay. I'm over 60. I have a JADEP card and also an NHF card. Ms. Narika mentioned when she was speaking that the benefits on both cards are now or can now be, I wasn't sure, combined. So one doesn't need to be utilizing the JADEP card anymore. Is my understanding correct?
You are indeed correct. What we have done is to merge the benefits once you're 60 and over. So at the pharmacy, once the NHF card is swiped, it applies the respective benefits.
Okay, okay. So I can do away with my JADEP card then for these
Sure,
purposes.
Mr. Garrell.
Thank you very much. Thank you very much. One less
Mr.
Yes,
Moderator.
Sir Conroy. Sorry.
Just one general question.
Yes, sir.
Both the agents have suggested that you shop around before you do anything. But it seemed to get conflicting comments about generic versus brand name drug. Some doctors are saying use the brand name, not the generic. When we shop around, how do you know if they are equal?
Okay, so the pharmacies are all aware of the brand names as opposed to the generic. If your doctor write do not substitute, they are guided by that. So when you go to the pharmacy, you can say to the pharmacy, I don't want any generic. The JADEP program covers solely generic drugs. I hope that answers your question.
Okay. Okay.
Okay.
So use of generic drug, we are saying that wherever possible. I mean, we understand that everywhere it is not possible because some places, if a person is diagnosed with cancer and they have to do the branded drugs, those are more effective, then they should go with branded drug. But the generic drug should be used wherever possible.
Okay.
Thank you.
Thank you for that, Conroy. I have another question. This question has to do with the wellness checks. Now, what I think Nadine had spoken to was a feature on your policy, which I don't think many persons use. Nadine, would you say it's a very underused benefit, the wellness checks?
Yes, it is. It is very underused.
And so, and this benefit is really a preventative benefit, I would say, where persons could go in for a screening without any illness. You go to your doctor and say, my health card allows me to do a wellness check. And so I don't feel ill. I am not seeing any symptoms, but I would like a health check. What can we do? We meaning this education session is one, but what can the brokers and especially the brokers, because I don't believe that the providers would have an interest in promoting this benefit, the use of this benefit. But isn't it something that we should be collectively as a fraternity be seeking to tell more members on these health plans about, so that persons can go in and say to the doctor, see, my card says wellness check or health check. I want you to just come in and get a screening. I might discover something that is important and then can take proactive action to prevent something that can get worse. I mean, with delay. What do you say about that?
Okay, so when we were working at Blue Cross together, we had the wellness bus that just went out to places. That is not happening much anymore. I don't really look up on, when I was working at Blue Cross, Miss Hendricks, every minute, every week, they have a location and they'll go out. Since I left Blue Cross, I don't see that happen with Sagicor or Guardian Life. However, for example, my church last week had a health fair. So if we had the wellness bus, if persons had health insurance, they just presented their card, and if there would be a contribution, they don't have to spend any money, right? So when there's health fairs going on, or say any little event going on, and then there is where you can go and do your blood checks, just general checkup, because you go do your glucose and you realize that it is high. The person is there to advise you. At that time now, you can go back to your doctor, and if that person is a doctor, they can even write the diagnostic sheet form that you can go. But this is something that we as an individual, when we get our health card, we get the benefit sheet and we go through the benefit sheet, highlight some of the stuff that that you might use, because you'll have a full host of benefits, and 50% of them you might not use. but it's
That's
the
correct.
knowledge of each individual to know what do I have and
Right.
go through and look at what they have. Because you can't just say, okay, I'm just going to do a routine checkup. You can, because routine checkup, office visit, home visits are the
Right.
same cost,
Same
right?
cost.
It's
Right.
mostly used when the insurance company goes out with the wellness bus, or if there's a health fair, that's when persons really use it.
Okay. Thank you for that. Okay. Any other questions or comments before we conclude? Any other questions, comments? Okay, so it is just left for me then to give my closing comments, my closing remarks. It seems to me that, well, let me start with myself. Mea culpa. I myself, although I've had some experience and exposure, that is laughing, to this whole thing of health insurance, I myself need to do a little refresher course on my plans. But something just jumped in my mind before I'm going to do this wrapping up, then ask Mr. Fletcher to move the vote of thanks. When you are doing coordination of benefits, Mr. Kumar and Nadine, you have 3 policies. Let us say I have a policy from Sagicor, a policy from Guardian, and I have my NHF. Which policy is swiped first? Is there an order that you can take X from this and then take this? And so please just take us through that, please.
All right.
That for me is important for me personally. Yeah.
I am going to do it on a swipe and then also on a paper claim.
Right.
So in insurance, you have primary and secondary policy.
Right.
A major medical and a rider is always a secondary policy. How the insurance company look at it is which policy, base or the comprehensive, that you have first. So if you had the executive blue, no, most time the employer policy is always the first. So if you are, all right, say you are on Bethel and you already had an executive blue with Sagicor, you're through Bethel, you have a CCRP. So the executive blue will be the primary, then CCRP, then your NHF or your JADF.
Okay.
That's how it works. So even if you give the pharmacies all 3 cards,
right,
they will swipe the card. The system at the pharmacy knows who is first. They know everything. So it will swipe.
Okay.
Yes. All the system link the pre-authorization. It doesn't matter if you have a Guardian Life Canopy or Sagicor. It knows what should come off. However, if it is a paper claim, the insurance company put in, checked first to see which one is the primary. Then it takes 80%, the 20% that is left, the secondary policy, then that takes, and then the last policy, which is the third policy. So sometimes you pay $0. Sometimes.
Okay. So just to recap, it is the comprehensive, so-called comprehensive plan that is swiped first. So
Yes.
that one, and then you swipe the major medical or the supplemental plan after.
Yes.
And then you go to your NHF.
NHF or your NI Gold. NI Gold is also, those are, because those pay normally at 20, those are the last set.
Okay. So you might have to start walking with all your policy, all those cards. When you're going. Just walk with all the cards there.
If you go into a doctor's office, some doctors will only swipe one and then you claim, paper claim on the other.
Okay.
Yeah.
Yes,
Miss Petty, go ahead, Miss Petty. Go ahead.
No, I remember CCR.
Not
we
hearing.
We should try and use the NHF card first because of the high usage of the Sagicor card. CCRP was saying that we should try and use our NHF first before we actually use the Sagicor card, the chip card.
All right.
And let me comment on that.
You go
That's
ahead.
interesting.
Let
That's
me
interesting.
comment on that. The NHF pays a subsidy on each drug. So while for the Sagicor and the Guardian, the beneficiary has to pay a monthly cost to sustain that, for the NHF, it's not monetary. So we pay a subsidy on the drug, and there are instances where we cover up to 95% of the costs submitted. So for instance, the drug costs $20,000 and the NHS subsidies applied. What happens in the system is that if it's $7,000 leave, they apply, say, Sagicor 80% of the 7,000 that's left, and then 20%, whatever percentage is it that Guardian covers if the person has all three insurance. So for the NHF, because we pay a subsidy, most persons swipe the NHF card first. And once you swipe the NHF card, there's actually no reason for you to swipe the other card because it applies the respective benefits.
That's interesting. So I'm hearing a little different.
No, it is correct, but what we're to be mindful of, NHF is for prescription drugs. A policy has a whole suite of benefits. So if you're doing a surgery, you would use your NHF. So when the contract is said that you swipe your NHF first, it's only for prescription. NHF doesn't give you a dental, optical, consultation, all of that.
That's correct.
So it is depending on the benefit that you're swiping first.
That's correct.
You understand the benefit that you're swiping first.
Okay. And so
also, can I add something on this one? So
please go ahead, Mr. Kumar.
So you have, like, for example, you have 2 cards or 3 cards. Let's keep NHF card aside, because that is always swiped first when we are going to buy prescription drugs, right?
Right.
Or doing some lab test, which is covered under NHF, right? But for you have a Sagicor, Guardian, and Canopy, or all type of cards, the member has to understand that whatever expenses the person has made, they will be reimbursed up to that amount. Say, for example, a person incurred 100,000 in surgery, right? He has 3 cards, one from the employer, one from the association, one for himself as an individual person he took. So 3 cards. It doesn't mean that he will get 80% from everywhere. What will happen is insurance company knows which one is the primary insurance. So always the employer is the primary insurance. So the insurance company will pay from the employer policy, whether it is Sagicor or it is Guardian. If you don't have employer, then it goes to association. And then at the end, it comes to individual policy. But the person would be, the person would be refunded to that amount, whatever expenses have been incurred by him. It won't be, anytime it won't be more than that amount.
Well, thank you for that. My very last question. I have a policy with both of you, and this is the closing question. I have a policy with FFK, and I have a policy with CCRP. Now, CCRP, and that's the major medical policy, right, from CCRP. But CCRP requests that I pay $100,000 deductible before I can get access to any of those benefits. Now, what they say is that any money that I pay out of pocket, I'm supposed to do what, Nadine? Do I send a claim in? How do I accumulate this 100,000? How do I keep a record to say that, look, I have been paying out of pocket towards this 100,000 deductible, because the other policy doesn't cover everything. So I'm still paying something out of pocket. So just walk us through. I think some persons have both policies on this platform and need to know how to make the best decisions as to what to pay for when, what not to pay for out of pocket, so that we end up with a good balance of benefits from both policies. So let's just ask Nadine first, and then Kumar, if you want to say something, sir, Kumar.
How it works is that for you, persons that have Fraser and Fraser Fontaine, what will happen that will on the major medical, Fraser Fontaine now becomes the primary policy. Insurance company don't normally pay with photocopy receipts. So Fraser Fontaine is Guardian Life, correct?
That's correct.
Okay, so when you go for service, you swipe the Guardian Life card first. This is for persons that have the major medical. After that is done, or if it is a paper claim, what is done, you can photocopy the original receipt, ensure a Sagicor claim form is filled out. This is for paper claims, because you're going to submit the original receipt with the claim form to Guardian Life.
Right.
You're going to also supply a photocopy of the receipt with the original Sagicor claim form. And this is for major medical persons.
Okay.
And this will be for the lab or the X-ray or the MRI.
Diagnostic. Right.
Yes, because you want to accumulate the major medical of 100.
Right,
So
right.
after Guardian Life pays, and Guardian Life will pay way before 90 days before the claim expire, when you get an explanation of benefit sheet from Guardian, whether it's an email, whether it's a paper, you should take that piece of paper with the photocopy receipt and the claim form and submit it to Sagicor before 90 days. Sagicor will send an email to you saying this amount has been applied to your deductible. However, if it is a swipe situation, you went to do an executive profile, you swipe the card, the Guardian Life card, you will then pay, say it is 28,000 and Guardian Life pay 20 and you pay 8 from your pocket. What you'll do, that $8,000 receipt that you pay, you staple it to a claim form, have the claim form fill out, you submit it to Sagicor within 90 days. Again, it adds up. Those small amounts adds up.
Absolutely.
If you don't submit a claim within 90 days, Sagicor won't know because you don't get a swipe card for major medical. If it is a surgery, chemotherapy, radiotherapy, renal dialysis, hospitalization, it's a pre-authorization that is done. So for your doctor, your hospital, or the provider, they should take the both card numbers, put it on a performer invoice of what will be done. That does not come to Gallagher at all. It goes directly from the provider to Sagicor and Guardian Life. So the pre-authorization unit will write a commitment letter or a pre-authorization letter saying from the major medical, we will pay X. From Guardian Life, we will pay Y. Sometimes you might pay no money at all when both of them combine.
All right, good.
And then Sagicor will pay the provider. That's
All
it.
right.
We are not involved from once you pay your premium. So that is how it works. If it's a comprehensive, it is a similar benefit. Similar in the sense that some pharmacists, some provider will swipe the 2 cards, some won't. So anyone you use, anything, and you swipe from one, you write up a paper claim for the other.
Okay.
Right?
Nadine, please stop there, sir, because it's a mouthful. I'm going to charge you now, Nadine, with giving us a written, I'm sorry, what you just outlined is a major part of
we have it
working
written.
with.
We have it written. We're just waiting on Miss Thomas, our director, to approve it.
So please send it as soon as possible to the administrators at the church, right? Thank you. That's a very important thing you just explained, because that whole process you just outlined is causing people to be a little concerned that they're not getting the 100,000 thing is a little challenging. Seriously, Nadine. Sir Kumar, any last word from you on this? Closing.
Well, from my side, I just wanted to say, like, for example, for surgeries, you can always satisfy that 100,000 deductible at one go when you have a surgery. But when you have a smaller claim, you always have to submit those claims to the insurance company so that they are aware, okay, you have paid 5,000 now out of your pocket, next time 5,000. So they keep on accumulating. Once you have 100,000, then you enter into major medical, and then they will also start paying. So always submit your claims and keep receipt of your claims forms after submission also.
Okay, so it might be good then if the person doesn't pay any money out of their pocket for this 100,000, because they might never ever use Nadine. They might never ever need to pay to get into major medical. So what do you say about that? Do they just don't engage until they need to pay it, or they still pay towards it?
No, pay towards it. You might never know. Remember, it's not just sickness alone. You can be healthy now, and you just go and do a checkup, and the doctor says, oh, you have cancer. You have to do your chemotherapy. You have to do your renal dialysis. You have to
Or
do
an accident,
radiation.
or an accident,
Or
where you need
accident,
major surgery.
you need
Yeah,
it.
that's true.
So it's better you just supply them. The expectation might be there. You can keep the
Okay.
copy of the receipts on your
Okay.
phone or write it down. But
Okay.
don't let if I did know comes, because it won't fix.
And thank you very much, guys. I think we have really gone to and thank you so much for that extended. That was supposed to be a wrap up at about 20 minutes ago, you know. So really sorry about that, but that's right. And it's a very important thing with the discuss just now, because many of us have both and we're trying to balance, you know, out of pocket with stuff. So thank you so much, guys. By way of a recap, you know, thank you, Nadine, for explaining what we have as benefits on our comprehensive plan, our major medical plan, our basic plan, on the supplemental plan. And the three ways of getting it is that we can buy it as an individual over the counter from an insurer. We can join an association group. We're up to 7. I think it's the minimum 7 that you ask for to enroll. It can be a football club, it can be a church, it can be a little business around the corner, it can be, you know, just seven persons who are bonded by a common aim, and they are registered, as you say, as a legal entity. Thank you, Sir Kumar, for getting into the belly of, you know, the deductible, the corridor stuff, and, you know, explaining all the various nuances of how you should claim properly, because, you know, this thing about the diagnosis being stated on it, and how do you combine your benefits. Very, very important for us to maximize the use of our insurance plans. And Sister Jackson, want to thank you, Nurse Jackson, want to thank you for really taking us through the wonderful twists and turns of the NHF benefits, because I didn't know about this quick prescript thing. I didn't know about these drop off and these ways that you can get. So we are going to be looking in our pharmacy and clinic operations now to see how we can, at Bethel, to see how we can make full use of these benefits that National Health Fund offers. And I am going to say, no, it is the best government agency in delivering service to the public, bar none. And I dare anyone to successfully challenge that assertion at any point in time. So having said that, and you agree that, right? And so it is left to me then to ask the representative of the Bethel Baptist Church Men's Brotherhood, Mr. Fletcher, the one and only Mr. Fletcher, to move the vote of thanks on behalf of the combined group of the Bethel Baptist Church Women's Federation, the Healing Ministry, and the Bethel Men's Brotherhood on their behalf. Mr. Fletch.
Mr. Moderator, Ms. Nadine Edwards, Mr. Kumar, Ms. Jackson, and the chairpersons of Bethel Baptist Healing Ministry, Bethel Women's Federation, Bethel Brotherhood. Friends, good afternoon. We've gone into evening now. First, I must thank the wide audience participating in this webinar this afternoon. Surely without your presence, though it be virtual, our objective would be in vain. To the Bethel Healing Ministry, the Bethel Brotherhood, and the Bethel Women's Federation, we must give our special thanks for organizing this very instructive webinar. And I must also thank, before getting down to our presenters, Brother Hibbert, for attesting to the value of insurance. And now, how could we thank our presenters sufficiently? For we do owe them a tremendous debt of gratitude. In doing so, in the broadening our vague and limited knowledge, would you permit me to go back in time to a few months ago, when there was an exponential increase in health insurance premiums? our members were understandably enraged. And rumors had it that they had placed a heavy bounty on the heads of anyone who they perceived had caused them to experience this unbearable increase. Those who, through no fault of their own, had incurred the wrath of members were the providers, insurance companies, brokers, and even the actuaries who fairly addressed the risks, assessed the risks. The rumor further stated that in order to save their necks, brokers and other suspects went into hiding. And it was not until the Bethel group, the healing ministry, the Brotherhood, the Men's Federation, contacted them with great difficulty and convinced them that our motives were pure, that they decided to come out of hiding, come forward this afternoon. And in so doing, they have delivered a most enlightening presentation, causing us to realize that they are not our enemies or part of a great conspiracy in which the idea or the whole plan was to extort us, but intact with our best interest at heart. We certainly have benefited from their thorough knowledge of the field, and shall hope that when next you are able, that you will be able and ready to join us at maybe the Bethel Chapel, inside the chapel, or any place suitable at your disposal.
Face to face.
We do thank you for expanding our very vague and limited knowledge with such clarity. And we are looking forward to the day when we will also again be able to call on you. May God continue to richly prosper your efforts. Thank you very much.
Thank you very much, sir. Thank you very much, Sir Fletch. And so it is just left for me to turn over to the chairman of the Bethel Baptist Church Men's Brotherhood to offer the benediction as we close. Kirk Smith.
Thank you, Mr. Chairman. Job well done. The benediction. May the strength of God sustain us. May the power of God preserve us. May the hands of God protect us. May the way of God direct us. May the love of God go with us this day and forever. Amen.
Amen. And thank you, everyone. Thank you for spending this time with us. And we have a screen there that for those persons who want to have any follow-up conversations or any queries or any business that you might want to consider, or any transactions, say like with the National Health Fund, please feel free to take down that information on the screen and proceed as you so desire. Thank you very much. And we look forward to doing another series in a related area of interest. Thank you again. All the best.
Thank you. Good night.
The number for Gallego is actually 948. That is 876-948-4102. Thank you for sharing that information, Nadine.
so noticed this sort of disparity between Baptist people. Larger along color. Yes, yes. So as you bring up the country and you will really
Thank you for joining us and hope that everyone will have a blessed night and evening.
Yes. And then I found that was 15 of the girl.